Hi, what time are we supposed to start this session?
Hello, sir. Ankur this side from DIO. We are beginning soon, sir. We are waiting for the nodal officer to join, sir.
Got it. Thank you so much.
Thank you, sir. Colonel SS Roy, sir. Good morning, everyone. This is Ankur from iDEX DIO. We are also waiting for our nodal officer to join.
Okay. Good morning.
Good morning. Just for a quick glance, may I know how many of you have connected as a industry?
I have.
I can see Pareto Tree is there. And any other company? Those who have queries for this specific problem statement?
We are from Navisis. We are from Hyderabad.
Hi, sir.
Good morning, sir.
Good morning.
Do we happen to know if we have fixed some bugs? I have not been able to log in to the iDEX portal since yesterday.
You are trying to apply for the problem statement, sir?
I had applied for another one earlier. I'm trying to log in or reset my password. It's not working. I'm not receiving any reset links.
So I'm typing an email address.
Okay.
You can send in your query to this particular email address, sir. So we'll connect with our concerned team and hopefully, sir, so I have shared, sir, ankur.verma.idex@nic.in.
Got it. Perfect, sir. Much
So
appreciated.
we'll check with our website team, sir.
Sure, sir. I did email the contact on iDEX website already. I'll forward the same request to you.
Sure, sir. Sure, sir.
Thank
Thank
you,
you,
sir.
sir.
Hello, Ankur. Sir has joined. You can please ask him to start.
Sure, ma'am.
Yes, I have joined. In fact, I am waiting to start the proceedings. Can you hear me?
Yes, sir. Yes, sir. Hello, sir.
Yes.
Good morning, sir.
Morning.
Actually,
Good
sir,
morning.
we were waiting. Sorry.
I am also waiting for you guys to start it.
Sure, sir. So, hello, everyone. Today we are here for the technical outreach session for the AFMS problem statement 41. That is for the development of anti-fogging solution for vision field of CBRN respirators. So from the participants, may I request if you have like some specific technical queries, so you can like put in. Thank you.
Like I have, I'm Colonel S.S. Roy.
Yes, sir.
Earlier, I was in the headquarter IDS made as a Colonel CBR, and presently I have been posted to Kolkata as a CEO of a field hospitals. So my problem statement is pertaining to the visual field. When we are using that canister with respirator, it is causing that is quite a disturbance in terms of fogginess of that plastic sheets and not giving a clear vision for pre-hand working. So it is a major cause of concern for the soldiers.
Thank you, sir.
Am I audible?
Yes, sir. Yes, sir. You are audible, sir.
So that is my main concern. And
Sure.
I have given the problem statement in that particular issue only. Yes, I think this is my statement.
Right, sir. Participants, do you have any queries or questions from your side?
Hi, this is Ajay from New York. Good morning, sir. Sir, I have a question regarding the availability of these devices. So, is there any solution available in the market? Like this, we have heard that there are many anti-fogging glasses as came up from some companies. So currently, how this need is satisfied? Like somewhere it might be used.
As of now, whatever CBRN IP suits available to us, that particular IP suits is not having that anti-fogging latest update technology sheet plastic sheets. But I also have done some groundwork in that. I have seen these are available in the market, but that plastic sheets are good quality plastic sheets with anti-fogging properties available, but it is not part of that CBRN IP equipment oblique suits. That needs to be incorporated in that IP.
Noted, sir. Thank you so much for the information.
Any further questions? Any queries from the participants?
So, may we request your email ID for sharing our concerns, if any?
You can ask in into this live session itself, na, Mr. Sachin.
Uh, No, actually, our technical team, they had some queries. They're presently not here because this was taking time, they left.
Okay.
Uh,
So you can
There would
send
not
in
be
your
much, but
queries.
in case if there is something, so I thought I'll just sort up that query or get direct clarification from you.
Sachin, you can leave a query in the query box that is available on our website. Otherwise,
That doesn't, no, I don't think there is any query box as
there's a
such
drop
for any
down.
problem statement.
There is.
What I have done for all other this thing, the nodal officer had given their email, so we are interacting with them directly.
Anybody else who has a query pertaining to this challenge? If not, then thank you, sir, for joining in. If we receive any queries over the email, we will forward it to you them and request for the clarification.
Okay,
right,
that
sir.
will be good. That will be good.
All right, sir. Thank you.
Now I can.
Yes, sir.
opt
You
out?
can log out. Yes, sir. Yes, sir.
Thank you.
Thank you, sir. Thank you, ma'am.
So our next session would begin at 11. If people who are interested in listening to the MRI compatible multi-parameter with accessories, you can stay back. Otherwise, thank you everyone for joining in.
Can
We'll
we
keep the
shoot queries to you through you for that particular problem statement for this thing 41?
yes, yes.
What's your email, Kirti?
No, you can take the email ID of the iDEX that we have on our website to send in the query. Ankur, if you
No,
could just post that.
Ankita, Uga, I mean, we are sharing queries, keeping them in CC and directly shooting to nodal officer or through them we are saying. But
Yeah, but Sachin, it is not happening like that here. So that's what I'm saying. Ankur, if you could
Yes,
type
ma'am.
in the
Sure,
email
ma'am.
ID in the chat box.
Ma'am, actually, you can see ankur.verma.idex@nic.in.
Ankur,
You can see in the chat box. I've
chat
already
box is
typed.
there. Let
Yeah.
me check.
So you can send in your queries, and there will
Yeah.
be a query form also that will be hosted on the idex.gov.in. So you can send all your queries to that particular query form itself.
Done. Thank you so much.
Thank you.
Hi, this is Himali. Just a query. What I had was, for the problem statement number 38, which again is the AFMS. Do you think an outreach is planned sometime this week?
Ma'am, we have to check with concerned people, and hopefully we'll revert back very soon.
Okay. Because it was related to CBRN itself, but I think Colonel Roy sir is not handling that, so I'm not sure about it.
We'll check, ma'am, and hopefully if there is a planned outreach, so that will be listed on our social media handles. So
Sure.
we'll request you should follow our X page and LinkedIn, and you'll get the updates regarding the schedule.
Yeah, that I'm already doing it. Thanks.
Sure, ma'am. Thank you.
Ankur,
Yes, Mr. Sachin.
yeah, there's another concern that in other outreach also, we have requested all project nodal officer to grant us some more time. I'm sure you all must have also got such request. So you can just put in a word for us.
Sure. This is for like AFMS challenge or in general, like
All
test
because
challenges?
when it get extended, it'll get extended for all, na? All ADITI as well as
The timeline you are saying, sir?
yeah, timeline. 11th is too
11th is the
close.
last date as of now.
Yeah.
Correct?
If can be extended at least by a week or so.
Still, we will request that whatever you have.
Hi, Ankur, just one second. Sir, as of now, please try and understand 11th is the last date. There are still 4 to 5 days for you to formulate, which is good enough. So we, this time, the probability of the extension is very low. So request you to please all fill your solutions and submit it to us before the deadline. Let's not really keep stretching the deadlines from 4 days before the deadline.
Kriti ma'am, this is Ashwin from Hyderabad. I've made
Yes,
several
hi, sir.
attempts to log in, ma'am. The portal is down several times of the week, actually. It's been down since yesterday.
Sir, what you can do is you can send us the screenshot and Ankur, that is why I'm saying if you go in the chat box, please type in the iDEX email ID. And anybody who is facing any of those challenges, request you, sir, to please send us the screenshot ASAP so that we can get it resolved.
I had discussed this on the call day before yesterday as well. I've emailed the team yesterday as well, ma'am, but it's down. It's been down for a while now.
Are you also a winner with us?
No, ma'am. I'm participating.
No, have you ever, this is your first iDEX challenge that you're applying for?
No, I've applied for them in the past. I've applied for one a week and a half ago. Now, when I'm trying to reset my ID, it does not send me any reset messages.
All right. Let me, you send us that, you forward us that email on the email ID Ankur is given. We'll try resolving it by today, or at least give you a reply on what is the issue.
Yes. Ankur sir, did you get my email? I had forwarded to you like 20 minutes ago.
Sure, I will check. Thank you.
Thank you, sir. Thank you, ma'am.
Welcome, ma'am. Thank you for joining in the session. Ankur, request you to please flash problem statement 37.
Sure, ma'am.
Thank you for calling me here. Thank you. I'm here.
Yes, ma'am. If you could just generally introduce the problem statement, and then the startups will start with the questions. Thank you. Over to you, ma'am.
Thank you so much. Do you want me to read from this, or should I tell what exactly we had in our mind?
That's it, ma'am. You need not read from here. Just the crux of it, of why this is launched, so that if they have any pertinent questions, then they can get it
Okay,
answered.
okay. Thank you so much for this opportunity. So my name is Surgeon Captain Vidhu Bhatnagar. I am HOD Anesthesiology here, Department of Anesthesiology in INHS Ashmi. That's a naval hospital, tertiary care hospital. So we've been doing this MRI for small children. MRI is magnetic resonance imaging, which we do as a radiology technique for imaging of people, of brain, spine, anything for that matter in the entire body. And for very small children or small children, they cannot lie still. So it takes around minutes, 45 minutes, sometimes even 1.5 to 2 hours. And some very critically ill patients also require some kind of support from anesthesia side. So either it is sedation or it is general anesthesia. Now what happens, we require lots of monitoring, but all our monitoring is not MRI compatible. And there are definitely few vendors who give MRI compatible, but it is extremely expensive. So many times, many hospitals do not have that MRI compatible monitors, and it becomes difficult for us to monitor a patient, though we are giving sedation, general anesthesia to small children. It becomes really difficult for us to monitor whether it is safe, whether they are safe. Sometimes we have to abort and we have to get them outside, because we can't even resuscitate them inside, because nothing metallic can be taken inside the MRI suit. So that is why we thought of, having this kind of a challenge where it is not very expensive, so that it is easily available to even peripheral setups. Because MRI these days is everywhere. It's not that it's only in tertiary care. In peripheral setups also, MRI is available. Outside in civil also, it is available quite freely. So monitoring is one important thing which we wanted. And in monitoring, we especially wanted end-tidal carbon dioxide. That is also a very routine monitoring, which we have it outside. All our anesthesia workstations have end-tidal carbon dioxide and respiratory gas monitoring, but especially the MRI compatible ventilators, I'm sure they may be available, but I have not seen them in armed forces. That respiratory gas monitoring and ETCO2 is not available with us there in those monitors. So that makes our life simple, because if we keep seeing carbon dioxide coming out regularly, we know the patient is alive and breathing. Otherwise, it becomes very difficult for us to see whether it is safe to put the patient inside. And then another which we required was invasive monitoring, which mostly is arterial blood pressure. So we put this small catheters inside the artery, and we monitor arterial blood pressures. Again, there are transducers, and they need to be MRI compatible to be working inside the MRI suit. MRI monitors, ECG, everything also, and they also should not cause any burns to the patient. So that is also another concern which we have. So anything which is not MRI compatible, we cannot use it inside MRI suit. And then we wanted a slave monitor, which is outside. So which can be, because otherwise what happens, we have to be 2-3 people have to be inside the MRI monitor. So it's not safe for healthcare professionals also to be for so long to be subjected to that kind of noise, because patient is coming only once, but that healthcare professional is there from 8 in the morning till 5-6 in the evening, subjected to that huge kind of noise. Despite the noise cancellers, the noise is very high. So we required slave monitors outside in the console, or in other places which can be connected, so that the monitoring is seen remotely. And if something can be done, or if some expert help is also required, like if there is a specialist there, junior specialist, and they want some expert help, so they can talk to their seniors and do something about it. So that was the problem statement.
Thank you, ma'am. I would request the startups to please ask the questions.
Hi, ma'am. Launch this site from Pareto Tree. Pleasure interacting with you. I've gone through the problem statement. It's very detailed, beautifully written. I appreciate that.
Thank you.
Making it MRI compatible is something that's doable. So just to give you a little bit more background on us, we've been working on wearable medical devices for the last 4.5 years.
Yes, please.
We've built a wrist wearable device, like a smartwatch essentially, that monitors your respiratory rate with
SpO2.
98%
Yes.
sensitivity. Yeah.
Yes.
So to heart rate, but it also measures blood pressure.
Yes.
It measures blood pressure up to, in a way, arterial blood pressure, in the sense that I can give you pulse pressure, I can give you MAP, I can give you
Understood.
BP and things like that. And we've been working with AIIMS Delhi on this very closely for the last 2 years now.
Yes, please.
But actually, we'll be validating it soon. That said, now ETCO2, you want it on a side stream. Can you help me visualize that environment exactly?
Okay. Okay.
How does it fit in on a side stream? Yeah.
Yeah, I'll tell you. So what happens in a spontaneously breathing patient like me and you, or if a patient is breathing spontaneously, means we have not put them on any kind of gadget, endotracheal tube or eye gel or something. Monitoring ETCO2 becomes a little difficult because so much of the air is getting entranced and getting mixed with the atmospheric air. So we require a certain thing. And now most of our MRI patients are spontaneously breathing. They are under sedation, but then we don't put any gadget inside their mouth or something to control their breathing. They're breathing on their own. Does it make sense? They're breathing on their own, but we still want to monitor whether they're breathing regularly or not regularly. So this end-tidal carbon dioxide, if I fix it to the nose, and it is in a small compartment so that there is not much of mixing with the atmospheric air, and we can actually sample that and find out. Now, there are two kinds of end-tidal carbon dioxide, one side stream and one is mainstream. Mainstream is a huge thing which is connected, like usually I know about the ATCO2, about the endotracheal tube ones. So I have not seen spontaneously ones. So they are connected to the endotracheal tube. So it's a huge gadget which is connected to the endotracheal tube, but it makes it very heavy. Side stream is just a small catheter which goes to side of, and it is connected on the side of the monitor on a module. So that makes it lighter.
Got it.
So like if I put something very heavy on patient who's awake and only lightly sedated.
Agreed. That makes sense. And for the respiratory gas monitor that you've written, is it primarily just the capnograph that you're looking for?
Okay. So in our advanced anesthesia workstations, we give certain inhalational agents like you must have heard of sevoflurane, isoflurane, desflurane. We give these gases to keep patients asleep under general anesthesia. So for maintenance of anesthesia. Now, some of our patients are very ill. Like most of the patients in MRI will be under sedation. So we may give them total intravenous anesthetic agents. We may not give inhalational agents. So to make it simple, actually, we have two ways of giving anesthesia. One is by giving IV, drugs, and one is by giving inhalational agents. Now, these inhalational agents are the drugs which are the sevoflurane, isoflurane. They are connected to the workstation, and through a closed circuit, they are being given to the patient's lungs. Now, what happens? There is something known as a minimum alveolar concentration, which helps us, okay, how much we are giving. So see, if I have put on my volume percent as 2, but it going inside patient maybe 0.5, 0.6. So I require a certain amount of depth to be maintained. So I need to monitor that minimum alveolar concentration, which is given by respiratory gas monitor. So they'll be checking, the respiratory gas monitor will be checking which gas is going inside, how much it is being utilized and how much it is coming out. Now, this is a regular feature in all our advanced anesthesia workstations. So outside MRI, we have always there. So it's not that it is something new.
This is a little bit of a tough one. I understand that.
Okay.
But
Okay, that's okay. Whatever you are able to give us that. But like if to make you understand, this RGM is available in all. If you go and see any other normal advanced anesthesia workstation, which is not utilized inside MRI. I'm not sure, maybe there must be some advanced anesthesia workstations inside the MRI, but I have not seen as yet. Could be, I'm sure there, but I have no idea regarding that.
got it. A couple of other questions.
Yes, please.
Is there an MOQ for this particular challenge? Like, will there be, if we've built this successfully, will there be like a certain number of units that will be there after trials and whatnot?
We'll let you know the MOQ during the after the HPSC, but yes, there shall be an MOQ attached with it.
Yes, because I'm not the correct person to answer
Got it.
that.
Yeah.
Yeah.
Got
I'm the technical member.
Got it.
Yeah.
Just one quick thing towards the end. Do you think like a wearable device like that provides majority of it and then a separate side stream type tube for CO2, will that
Yes,
work?
it will. So I'm not sure whether it will give us ETCO2. Definitely wearable devices do give us saturations. So if they can be, Bluetooth outside or somehow connected to a slave monitor outside and also a monitor inside, we'll be able to see it. Why not? Something put on the head or something put on, belt kind of a thing. I don't know, just
Yeah,
like belt or something like that if it could be. But I'm not sure whether ETCO2 will be able to come because what you are saying about the digital
ETCO2 won't.
smartwatches, yes, it is there.
Yeah.
We have seen so many of them, NIBP, SpO2, respiratory rate. Yeah, that comes.
Ma'am, also,
So if it is, why not?
what is the percentage of pediatric patient compared to adult patients? Like if out of 100, how many are pediatric and how many are adults?
Okay, so you see what happens when we are involved, like the Department of Anesthesia involved, so we only know about the pediatric patients or critically ill. The normal patients, the normal adult patients, they never even call us because anybody who's able to lie down in that until unless that person's really claustrophobic, they do it. So my OPD every Saturday I have an MRI and I do get 5 to 6, sometimes even 10 patients. And outside, which is a busier center, we'll get, like when I was in Chitra, we used to get even 20 patients, pediatric patients. So it depends on the center, how busy you are, but you definitely, these days, children like neonates are being born at such a young age, we are able to, survive. They survive even at a gestation age of 30 weeks, 35 weeks, which earlier, the 28 weeks, which earlier was not even thought of. But then they do land up with so many problems. So they require MRI for brain, MRI for spine. So we do get neonates also. We get children of all ages. Like just newborns, we get children of 10 years of age. We get children of all ages.
Okay.
So it's not that it is only for like benefit versus maybe, and I think you're thinking how many patients will get. Oh, you definitely will lots of patients.
I was actually thinking because from a certification standpoint, ma'am, because for the FDA, it becomes very
Yes, you'll
tricky.
require
Right.
how
So
many
what
number of patients?
certifications are
Yes,
required,
yes.
ma'am? What certifications are exactly required? Do you want this to be FDA approved or CDSCO approved or?
Yes, it has to be some because I'm going to put it on patients. So somebody has to at least approve. It is, it is
Safe enough.
certifiable. So,
Right.
yeah.
Got it. Just sorry, Kriti, quick question. Is there a time limit on this challenge? Time limit in the sense like
Yes,
does
yes.
it have to be finished in 12
11th
months?
November. 11th is the deadline for you to apply.
I'm asking something different, which is like sprint mein tha na ki it should be completed in a year. Does this have like a time
No, this is
span?
normal.
24 months?
Normal 2 years. 24 months is the development time you'll get.
24 months. Okay.
Yeah.
Okay.
Yeah.
This is very helpful. Thank you so much, Vidhu ma'am. I appreciate it. This was very helpful.
Thank you so much for being there. Thank you so much.
Thank you.
Anybody else who might have a question, please go ahead.
Yeah, Nitin here from Pune. Kirti ma'am, hello.
Yes,
Dr.
hi,
Vidhu,
sir. Please go ahead.
Yeah.
Yes,
This
please
is
go ahead.
I was selling a Philips Expression MR or Envivo monitors. I have repaired also a couple of them. You required the long cables. And do you expect the complete system to be? I know what are the exact requirements. So
Yes,
a
yes.
similar
You
system
work
needs to
Philips,
be
yes.
developed, right?
Yeah. Similar system needs to be developed, less heavier or like if less of cables, similar system needs to be developed. Absolutely. That is
So
what I said. It is
wireless
available.
sensor, do you recommend wireless sensors or you will be okay with the cables? You have
So,
something.
yeah, so that safety needs to be seen. If those, whatever wires we put inside, like if I have to put on patient, then
Yeah.
they have to be again MRI company. They should not cause burns. So I'm
Yeah,
okay
yeah,
with
I know
wireless
that. I know
cables.
that. I know that.
Yeah, I'm okay with wireless cables because that makes our life so much simpler, not
Yeah,
so many
exactly.
cables.
That is what I am thinking of.
Yeah.
So
Yes.
and also the outside monitor which you have, can it be
Slave
connected
monitor.
wirelessly? That is what my
Yes, yes. We'll be
that-
very happy to have wireless monitors because
Because-
that makes our life also very simple.
yeah, currently because all the people current
All are with
generation are
cables.
all with the cables.
Yes, with cables, yes.
So,
So the distance and remote monitoring also becomes like it is not very perfect because it has to be only till a certain place that because it is cable connected.
So mostly we are driving our design towards wireless or wireless designs for the
Yes.
sensors like
Yes, yes.
ECG, NIBP, SPO2,
Yes.
and
Yes.
but ETCO2 I have to have a cable because I don't see any
Yes,
possibility.
that streaming will be required.
Yeah,
But at
that
least-
is not
so
that.
at
So only one
present,
cable. That
SPO2
is why I am trying to move.
Yeah, so at present SPO2 wireless is present, but ECG is still not present. ECG still has all cables. I'm sorry for this.
Yeah, but if we connect it a small box kind of scenario, just like a wearable, and then it transfers the signal, that is possible. We have
Yeah,
to
that
check.
is yes. Oh, the only that safety point has to be seen that it should not create any burns on the patient's body,
Certainly,
and it
certainly.
should not be too heavy that the patients are not ready to wear it.
No, it's perfectly fine. I got the message. It is
Yes.
just a 50 grams or 100 grams, just like
Hanji, that's just like a watch.
an Apple Watch kind of a
Yes,
scenario.
yes. Hanji, that's fine. That's a good thing. Yes.
Yeah. Okay. Thank you.
Because them will be my children, but what you are going to make is going to be adults. So then if that can be replicated for children also, needs like where should I, like if it is a small 3 kg child, where will I tie that watch, on the leg or, because that also needs to be, if I don't know, I'm just,
I'm
speaking
getting
it out, what is coming in my mind. Yeah.
Yeah. So let me figure it out, but we are moving towards that. I will just send you the details. Okay.
Thank you so much. Thank you.
Thank you, ma'am. Thank you, Kirti, ma'am.
Thank you, sir. Any more questions? If not, everybody who's present, you're also open to send us any queries if you may have over an email, and request you to please submit your proposals by 11th. That is the last date for application. So,
Madam, when is the outreach for problem statement 38 NBC suit
sir,
air
all
conditioning?
the details are there in the Twitter for this particular challenge. The nodal officer is not available. Request you to please send us the email the query over the email.
Okay. Because outreach gives a very good insight of the problem.
If you have any questions pertinent to this problem statement, you can please go ahead.
No, not here. Otherwise.
All right. Ma'am, thank you so much for joining in. And we will be in touch with you in case we receive any queries over the email. And thank you once again for joining in today.
Thank you so much. Thank you, Kriti. And thank you for reminding. Thank you so much. Thank you. God bless
Sure,
all
ma'am.
of you.
All right,
Bye-bye.
ma'am.
Take
Thank
care.
you. Bye.
So I leave now. Is that okay?
Yes, ma'am. That is okay.
Thank you so much. Bye-bye. Take care.
Bye.
Kriti, sorry to bother you, but is there any way to just get a rough idea there will be an MOQ and what the MOQ will be for this 37 before we apply or before we move to HPSC?
Hi, good morning, Sir Sindhu, sir. Sir, are we audible?
Yes.
Right. Wish you a very good morning, sir. Thank you so much for joining us. Sir, requesting your insights on the problem statement 34. That was for Meera challenge. Sir, over to you.
Okay, thank you, ma'am. First of all, this project is regarding the detection of the cognitive disturbances of serving personnels. Importance of cognitive disturbance detection is the operational ability of the serving persons. See, whenever any person is deployed in a difficult area, whether it can be high altitude or counterinsurgency area, or in sea, or in submarines, that person's operational ability depends on his cognitive status. So, basic concept behind this project is we have to make a device which can detect the cognitive problems of a person whoever deployed in the difficult area. So this device is consisting of few physical parameter measurements and few questionnaires. That questionnaires are already decided by after discussion with psychiatrist and neurologist, and they are also with us in the board, and physical parameters are also included. So this is the basic problem statement behind this project. Any questions regarding that?
Hi, good morning, sir. This is Ajay. So, sir,
Yes.
this system needs to be integrated into the helmet because in during the operations they will be on the they have some their suits.
Basically, what I was thinking, ki we can make a booth type system, suppose. See, every time psychiatrist or neurologist is not available everywhere, right? So we can make a self-assisting booth type system where all the peripherals will be attached with the computer, and that person will go and sit there, just attach that peripherals. Questions will come in the screen, or you can use a VR set for that also. So that person will wear the VR, wear the peripherals, and it is just a 45-minute to 50-minute session. And after that, that person will walk off. What happens? The every readings will go to the database, and by using the AI, that final diagnosis will be done ki whether this person has the cognitive problem or not. If that person has a cognitive problem, then that information will given to the in charge of a ship or the commander, whoever is the superior authority. So for as a result, what happens? We can take a decision on the moment ki whether that person should be shifted to the hospital or not. This was my plan. Over to you.
Sure, sir. Okay, got it. So I was thinking that you require this into the battlefield scenario for the
Yeah,
continuous monitoring.
yes. See, this if the system is portable, then nothing like it.
Okay.
Because we have to run a AI model. For that, maybe we need some better high-end system for that. But that thing we can discuss and rectify later also.
Thank you so much, sir. That's all from my side. Thank you for the time.
Okay. Any other question? Any other questions regarding technical part?
May we have questions, please?
Yes, ma'am. Good morning. This is Vishal. Can you hear me?
Yes,
Sir, loud and
Vishal.
clear. Please go ahead, sir.
Sure. So my question here is, what kind of peripherals are we looking at currently? Are there any specific aspects in mind with respect to that?
Yes. For hardware part, what we are thinking about it is the EEG sensor. Okay. So EEG sensor, you can place that EEG sensor in a
polymer based flexible helmet type thing with already placed sensors, so that person will wear that whole helmet kind thing in his head. And next is heart rate sensor. Eye tracking can be done by the VR set, and biofeedback, emotional regulation sensors. There is a heart math sensor is already there, and for virtual reality, goggle set is already there. So all these things we can incorporate in the system. Yes, Vishal.
Got it, sir. Thank you.
Any question?
And also, sir, during the development process, so do
Yeah.
we will get the time frame for the pilot testing, like getting the readings and kind of a clinical trials? So that will be
Yes. Clinical trial will be done because as a part of AFMS system, when we develop the whole system now, then we can do the launch the clinical trial, and we have to register that trial under ICMR. Okay, so we can do a multi-centric also, single center or multi-centric, anything can be possible.
got it, sir. Got it.
Any question?
Sir, one other question is, I'm probably new to this field, so I would want to understand what kind of certifications or regulatory approvals that this final product should go through. Who would be the authority for that, and how much time does this usually take? I mean, this entire process of approvals.
See, for clinical trial, it takes almost 6 to 7 months. Almost 1.5 months will require for the registration and all kind of documentation process. And main thing is development of prototype. When we come up with the prototype, then after that we can start the clinical trial. Yes, before launching the trial, 3-4 certifications are required for the biomedical devices. Two certifications are required, like CE certification and few other certifications. In Jaipur, there is a firm, they are doing the evaluation. So from there we can get those certificates. So that will take almost a month. So main thing, first thing is we have to develop the prototype as early as possible. If suppose we are assuming कि product development will take 6 months, 7 months, like that. Yes.
Understood, sir. Thank you. And also one other question which I had was, is this entire concept, is it like in order for induction, final induction, and getting the acceptance of necessity AON, uh, is that will that be decided post evaluation of the prototypes that come out of this program, or is such a thing going to be inducted at any cost? Like, just to get some more clarity on that.
See, when we get the clinical trial done, then we'll get the clearance certificate from ICMR कि okay, this device is non-invasive and not harmful for the use and all kind of things. After that, we are free for the induction in the forces. Okay. And it is not only for forces. When you develop this device from commercial point of view, you can mass produce it and deploy it at any part of the country, any hospital, because cognitive disturbances measurement is highly important. See, mental health issues are rising in our society day by day, and everywhere psychiatrists are not available. So use of this device is not only for the soldiers, it is also for general public also. So in that point of view, it is, yes, it is always highly useful device. So from market size, you will get a huge market size after production.
Got it, sir. Thank you for that insight. One other thing is that so this project has broadly two aspects to it. One is the hardware, uh, which is predominantly biomedical related, and the other aspect is the AI software.
Yeah.
Probably coming up with a model that could try and understand or categorize uh, the the person based on whatever values are being read. Now,
Yeah.
will we, I mean, we being, at least from my perspective, technology is one part, but then being able to have a model which can be of use to the end user, which is for a psychiatrist to make some sense out of it. Will we be
Yeah.
getting some help from, let's say, a neurologist and psychiatrist to
Yes,
kind of?
yes. They are on board with us. So when see by using EEG you can eliminate 7-8 parameters from EEG. Okay, by
Okay.
using single questionnaire, you can devise 7-8 different measurements. Like I'm giving example, there is something called 3D trail test. So by using 3D trail test, you can diagnose on the cognitive flexibility and visual spatial ability. So like that. So our target is to not exceeding 50 minutes. See, one person cannot sit one chair and answering the questions for 2 hours, 3 hours. So we have to customize the system like that. Ki within 45 to 50 minutes, that person will able to answer all the question or can detect the images. Like when if you're using VR set, we can show different images and we can see say that person to give the repercussion. So there are different methods are there. Okay, there is something called 3D picture construction. So by using such a things, we can shorten the time span. And yes, peripheral is already measuring the vitals and body parameters. That will doing the going through simultaneously. So yes, we can get help from the psychiatrist and neurologist also. Anything.
Thank you so much, sir. And sir, is there any baseline examples that we can, or any companies or any product which is already there in the market that could help us form, a baseline understanding of what the expectation is?
See, such composite device is not there. Such composite device is not there. But yes, those questionnaires are used for a long time. So already those questionnaires are validated. Those methods are validated. Say like a clock draw test or visual spasticity test. All those methods are validated. Our point is to why we send it to iDEX. We have to make a composite device. Such kind of thing is not available in a market. So that was the main motto behind that. We make something new, composite, even portable, and also a little bit low cost. So that is the thing behind this.
Okay, sir. So by composite, you mean the hardware as well as the software, the
Yes,
like.
yes.
Okay, so if I've understood it right, the questionnaire aspects are already validated and are pre-existing. I think what we
Yes,
need to be doing is connect the hardware on one side and then have a AI model run on the background on the other side. I think those would be the
yes.
the new content that we would be developing.
Yes. We don't have to develop any questionnaire because those questionnaires are already given in psychiatry book. So
Understood.
we have to talk with psychiatrists and neurologists. They will suggest us ki, okay, take this questionnaire. This will cover the 45 minutes of time and you can display it through the either computer screen or VR set. I think VR set will be much portable. So just imagine like a suitcase kind of device which you have all kind of peripherals you can connect, and with a VR set that person can sit inside a small booth in calm and quiet place and give the answers, sit for 45 minutes and go off. So this is the main concept behind that.
Sir, something which can be based on a tab or a iPad basis with the connectivity, is this a good approach or you have a different thing in mind?
And I'm little bit skeptical about iPad and all these things because see,
No,
after
we will give a knob sort of a thing for a couple of like a CogniView is a system in US which I have seen. It gives a complete programs also and it gives some tools also. So
So what we can do, we can develop a small system, one part which gets the information from the peripherals,
yes,
and those informations will fade into the hard disk,
yeah,
and another processing unit should be there which will run those questionnaires in back.
yeah,
So
yeah,
like that I am thinking. But I am
yeah.
not thinking
Yeah,
to place a
it's a you are
server.
thinking about a feedback system, right, sir?
Yeah.
Got it,
Feedback
sir.
system.
Got it. Yeah. Thank you, sir.
Yeah. Welcome. Any questions?
Yes, sir. My name is Vidyasagar from India Analytics.
Yes,
Today
please.
we have a product that is running as a non-invasive scans and can
Okay.
get the heart rate, oxygen, blood pressure, and some bloodless blood tests like HP,
Okay.
HbA1c, cholesterol levels, creatinine, all of
Okay.
this, just with a facial scan.
Okay.
And we also have a kiosk model for it. What you typically test with a cuff and a oximeter and all of the other peripherals that you're talking about. We
Okay.
have most of them coming from a face scan itself for about 50 to 60 seconds, 1 minute. That's all
Yeah.
a user have to spend in.
Yeah.
We have like about 14 vitals coming now, and we also have a AI-based cardiovascular disease detection, which is a heart stroke detection. We already have it working. Like if any person can give a same test at the same time for about 45 days, we can predict the heart stroke risk at least 45 days before. This is a pilot that we are running with Apollo hospitals here in India.
Okay. Okay.
So now looking at the peripherals part of it, and we also integrated some 15 Bluetooth devices which can connect to the app, like Abbott Freestyle for the glucose monitoring and portable. Here in Vizag, AMTZ, we have a portable ECG sensor that's like almost a small, what do you say, double the size of a 2 rupees coin with a small thickness. It's a portable
Okay.
ECG sensor that can connect to the Bluetooth. We already
Okay.
integrated that to that, so we can get the two-lead ECG right into the application, and AI
Okay.
directly working on top of the ECG, so that AI gives a summary to the doctor before doctor reviews it.
Okay.
We also have a TB detection, like which is you can cough at the mic for about 10 seconds, and we can detect the tuberculosis detection as well. So,
Okay.
so this is a background that we have, where we have been already piloting in India across. Last year, we've done a very big medical camp in Tamil Nadu for about 11,000 people. We scanned in 3.5 hours.
Okay.
So that's a Guinness record that we've established. So looking at this perspective into your problem statement that's been published out there, can we make this more robust? Like we already have a kiosk kind of a model, which is into a tablet fit into and everything. Can we make it a defense grade for that? And all the questionnaire and forms, we already have it in our application, where it comes under a separate module called as remote patient monitoring, where we work on like diabetes, for example, diabetes and cancer markers. These kind of a diseases, they go for about 20, 25 years time span, right? They don't,
Yes.
and then suddenly it will come to the stroke. So we monitor patients on daily basis, like we enroll them on a separate program on diabetes, let's say, depending on the severity of the risk. Let me give you an example of how we are piloting it at the moment. We have some open kiosks in Malaysia in airport where people can go in and scan this at the scans, and we were connected back with some private hospitals where data will be like an input to the hospital, and they recognize, okay, this patient have, it's a free scan. Anybody can go into there and take a scan basically. So
Okay.
so they can scan that and they get the vitals. If the person is identified high diabetes risk, the hospital will reach out to the patient and they'll enroll him on a 3-month program or a 9-month program like that. And every day we allocate some scans. It's like bloodless blood test basically. That's what we're doing with our face
Okay.
scan. So
Okay.
every day 5 scans per day we give them, and they collect the scans at the right time, and the medical assistant will be there to monitor these 1,000 patients or 20,000 patients. And every day, if diet monitoring will also be there. And so we monitor, this is a program that we're doing. So now looking at your perspective, how we can make this more robust for you?
See, you can make it robust, no issue. But one thing, we are more focused right here on the mental health part. And second thing is measuring by using picture scan. Scan means you are taking photographs and analyzing it
No,
in
it's a video
background.
selfie. In our case, it's a video selfie. We
Video
don't collect
selfie.
any, and we don't collect any face image. It's just
Okay.
technology called RPPG, remote photoplasmography. When light falls on your skin and it reflects back, that's where we calculate the signal, and based on that, we're calculating all these values.
See, now, technology, multiple technologies are available in the market. But
Right.
on clinical aspect, what is my question is the sensitivity and specificity of the method. Now we have to, do you have any comparative data with you, which says direct sensor-based data, which is attached with your skin, suppose.
Right.
That in, suppose we are measuring some heart rate or pulse
Correct.
oximetry,
Yeah, we
something,
already have
those.
the clinical validation, so it's like
No,
95 to
I'm
98%
not.
accuracy.
What is my question is just please understand my question.
Sure.
Suppose I am attaching some direct heart rate sensor with my hand, and that sensor giving me some data. So that is attached with the skin directly, and
Correct.
you are doing capturing the video thing. That is capturing the image of that area. So some sensor which is on contact with skin, and your method is doing the videography, which is not in contact with skin, not in contact with body. Now question is which method is more sensitive or specific? See, in medical science we have two purpose. One is screening and one is diagnosing. For screening we need sensitive. For diagnosing we need specific.
Correct.
So my question is your method is which is what? It is sensitive or specific? So as per that we have to think, na? हमें क्या चाहिए? That is the thing.
Right. So it's actually sensitive, sir, because it's not doing any contact. It's a contactless thing. In terms of specific, during the accuracy part of it, yes, for clinical trial purposes, when we have tested like all the devices attached and R values, so specific, few parameters are absolutely specific, and over a period of time, it will be better accurate actually.
Okay.
But because we've done a clinical trial kind of a thing where we have submitted to FDA all the clinical data in terms of accuracy comparison with, let's say, for handcuff, there is a device called as BMP withings, which is every doctor will put to our handcuff and then they pump the device. That one, and we attach the, let's say, ECG kind of a pocket oximeter, let's say, which is a finger we can place. That one. And we have drawn the blood at the same time while doing the FADO scan. All this is done a video recording. That's how we have submitted 150,000 samples, covering six skin types of the population, from pitch white to pitch black, from Malaysian to ASEAN people to Japanese to Bolivian people.
Yeah.
So we covered all these
Yes. So that needs the more training of your model to get the more accurate diagnosis. Yeah. You need more and more data, more and more image, and as if you start working in Indian population, you will get something different scenario.
Exactly. So that's a path that we are taking right now, sir. Recently, we have signed up with a contract with 1 million scans in India. That's like 10 lakh scans, which are done 5 lakhs in South India and 5 lakhs in Northeast India to establish that baselines and more accuracy levels, actually.
Yeah. Okay.
So we're already in that line. So I think maybe we'll come up with a composite device that's like a portable and you can carry everywhere.
Yes,
Since it's a
yes.
mobile application right now, maybe we can do it like a defense grade tablet, something like that,
See,
more secure.
what is our need? Our need, we cannot place those data in any distant server. We don't use any internet something. Okay, so we need a single standing running device. See, in forward areas, in difficult terrains, we don't have any internet access, no signals,
That's
nothing.
our advantage, sir. Our non-invasive scans is totally offline and you can run on device itself. It doesn't require internet.
Okay, okay.
It's purely
So,
on-device model and totally offline. Only thing that we check is number one, every scan we do the license check, whether it's a valid user that is calling. Number
yeah.
two, we check after results are done, we store it to the server calling an API. So in this case, we'll just maintain some on-device storage, and whenever it is connected to internet, it can transfer all of the data, something like that.
Okay, okay,
Uh,
okay.
Mr. Vidya, what is the name of your company again?
It's India Analytics. We are a R&D company, 10-year-old.
Thank you.
Yeah, sure.
Hi
Okay.
Vidya, good
Thank you, sir.
good morning. I have one question. So during the scan, if I'm feeling like kind of low, and if I'm very expressive, I can make the face very smiley or like looks very happy. So would that be shown a difference in the physiological parameters?
How it works is basically when camera is looking at your face, it will pick up one patch of your skin and at some particular area. Even we don't know. Every time we try to debug it in the back end, we find different patches of the skin for every scan. So it identifies one patch of our skin and it focuses the light that is going into that skin all the way till to the blood vessels and capillaries and how it is coming back. That's how it works. That's it.
Okay.
It doesn't care about the face data, who is this person and all. We don't check all of that usually.
Okay. Okay. Perfect. Thank you.
Yeah. So we're looking at the breathalyzers also. We have a patent on breathalyzer where it's a pocket breathalyzer. That's like a matchbox kind of a size of a thing, which can connect to this mobile app, and you can blow at the device while you're looking at the scan. All that can happen at the same time. So maybe breathalyzer is a good another option that we're looking at, trying to just doing the research. And in terms of continuous vitals monitoring, we have a band. We're experimenting with the jewelry right now, where we want to embed a chip into the jewelry, and it's just scratched to the skin all the time, and you collect all the real-time vitals. Like, for example, your blood sugar levels and cholesterol levels, they don't change very frequently. Like they change only 3-4 hours once after consuming the food. So only few vitals that will go in continuous monitoring, like heart rate or oxygen levels, this kind of a thing. So, we also have a band, by the way, for the fall care detection. Like for old people, we're doing one use case for the old people where if we suddenly get a stroke in the washroom area or in the kitchen or in the hall, this band will do the fall detection alert and it will send the alert to the response teams basically. And that's purely, but it's a Bluetooth one. We're working to make it a more it has a range of only 100 meters right now. We are looking to get a range of maybe 65 to 70 kilometers, something like that. That's under research that we're doing.
Okay. So any more questions?
Sir, I don't think there are any more questions as of now, but we'll be in touch with you in case we receive any queries over the email. I would also like to thank you for joining in today and clarifying the questions.
Thank you. Thank you.
Thank you,
What
sir.
is the contact point for the email, ma'am? Like,
So the contact point, you can use the iDEX, the query email ID that we have on our website. You can post in all the queries, but request you to please post them by today or tomorrow so that they can be resolved on time. Because the last date of application is 11th.
thank you, ma'am.
Yeah, all right. Shishendu Ghosh, sir, you can log out if required. We'll start the next session in about 5 minutes.
Okay, okay, okay.
Thank you, sir. Hi everyone. We've just received the information. The nodal officer is gotten stuck in the operation he was conducting. So any queries pertaining to problem number 34, 36, and 39, request you to please send in the queries over the email to us by today or tomorrow at last. And for the problem statement number 33, we will reconvene at 1500 hours. Thank you everyone for joining in. You can leave the meeting. Thank you.